Welcome to the deep dive. Today we're tackling a really important and fascinating subject, the female reproductive system.
Absolutely.
We've gone through some pretty detailed medical study materials to, pull out the core knowledge you need.
Yeah, the key stuff.
Our goal is basically to give you a clear picture of how it works normally, the changes during menopause, how it's assessed.
Common disorders, treatments, the whole picture.
Exactly. Think of this as getting that crucial info just without the hours of textbook reading.
Exactly. We're aiming to connect the dots for you, provide a solid framework for understanding female reproductive health. It's such a dynamic system.
It really is. And grasping these different aspects can be really empowering.
Definitely.
Okay, so let's dive in. Starting with the basics, the menstrual cycle. It might seem familiar, but understanding these hormone shifts, it's absolutely key.
Couldn't agree more. It underpins everything else.
So our sources talk about the follicular phase first, roughly the first 2 weeks.
That's right. Days 1 to about 14. It kicks off with a rise in FSH, follicle-stimulating hormone.
Right. And that hormone does what its name suggests.
Pretty much. It stimulates the growth of follicles in the ovaries. And what's interesting, as these follicles grow, they produce estrogen.
Okay.
And that rising estrogen actually starts to, put the brakes on FSH a little. It's a feedback loop.
Ah, like the body's own regulatory system.
Exactly.
And this increasing estrogen, it's doing something specific in the uterus too, right?
Precisely. Its main job there is thickening the endometrium, the uterine lining.
Preparing for a potential pregnancy.
Yep, getting that nutrient-rich environment ready just in case an egg gets fertilized and needs to implant.
Then comes the big event around day 14, ovulation.
Yeah.
The egg release. And LH is the star here.
Luteinizing hormone, yeah. There's a big surge of LH right around the middle of the cycle.
And that surge is the trigger.
It's the critical signal. It tells the dominant follicle, okay, release that mature egg now. It's a really precise hormonal event.
Wow. Okay. So after ovulation, we're into the second half, the luteal phase. Days 15 to 28, roughly.
Correct. And hormonally, the focus shifts now. The follicle that released the egg changes.
Changes into what?
It becomes something called the corpus luteum. Think of it as a temporary gland.
A gland. What does it produce?
Its main output is progesterone, and progesterone's job in this phase is all about maintaining that thickened uterine lining.
Keeping it ready for implantation.
Exactly, making sure the nest is receptive and stable.
So progesterone is vital if pregnancy occurs early on.
Absolutely crucial.
But what if pregnancy doesn't happen? What's the hormonal story then?
Well, if there's no fertilization and implantation, that corpus luteum, it doesn't stick around forever. It starts to break down.
Yeah.
And when it breaks down, the levels of both progesterone and estrogen take a significant dip.
And that drop is the signal.
That's the signal for the uterus to shed its lining, which results in menstruation.
And then the whole thing starts over.
Exactly. FSH levels begin to rise again, and you're back at the start of the follicular phase.
Okay, that gives us a really solid foundation on the cycle itself. Now let's shift gears to a major transition, menopause.
Right. A really significant life stage.
What actually defines menopause, clinically speaking?
Officially, it's defined as the point when a woman hasn't had a menstrual period for 12 consecutive months.
12 months straight.
Yep. And the underlying reason is the ovaries naturally winding down their production of estrogen and progesterone. It's usually a gradual process leading up to that point, but the 12-month mark is the definition.
And this big hormonal shift, it causes a lot of symptoms that people talk about.
It certainly can. The decrease in estrogen and progesterone can lead to quite a range. Hot flashes, night sweats, those are very common.
Why do those happen?
It's thought to be linked to the body's thermostat, its temperature regulation, getting a bit skewed by the changing hormone levels.
Okay, what else?
Vaginal dryness and thinning of the tissues there. That's also common due to lower estrogen, and it can cause discomfort. And then there are often effects on mood swings, maybe more irritability, and sleep disturbances are pretty frequently reported too.
And it varies a lot between individuals.
Oh, definitely. The intensity, which symptoms someone gets, it's quite variable.
And it's important to remember, it's not just about these more immediate symptoms, is it? There are longer-term health things to consider.
That's a really critical point. The long-term reduction in estrogen especially has significant effects.
Like what?
Well, one of the big ones is bone health. Estrogen helps maintain bone density, so when it drops, there's a decrease in bone density.
Which leads to osteoporosis risk.
Exactly. Increases the risk of osteoporosis, making bones more fragile. And there's also an observed increase in cardiovascular disease risk after menopause.
Really?
Yeah, the exact reasons are complex and still being studied, but the link is there. Lower estrogen seems to play a role.
So being aware of these potential long-term shifts is really key for proactive health as we age. Okay, let's move on to how healthcare providers actually assess the female reproductive system. Where do they usually start?
It always starts with a thorough history. Taking a good patient history is fundamental.
What kind of details are they looking for?
A detailed menstrual history for sure, like when did periods start, how regular are the cycles, how long do they last, how heavy is the bleeding, any recent changes.
Got it.
Sexual history is important too, and obstetric history of pregnancies.
Obstetric history. Is that the GTP-AL thing?
Yes, exactly. It's a shorthand. G for total pregnancies, T for term births, P for preterm, A for abortions or miscarriages, and L for living children. Gives a quick summary.
Useful. What else in the history?
Family history is crucial, especially regarding cancers like breast or ovarian cancer. That can highlight potential genetic risks.
Okay, history first, then comes the physical exam.
Right. That usually involves a breast exam feeling the breasts and surrounding areas for any lumps or abnormalities.
And a pelvic exam.
Yes, a pelvic exam. That starts with looking at the external area, then palpating the organs, feeling the uterus and ovaries through the abdomen.
Okay.
Then a speculum exam is done. That's using a speculum tool to gently open the vagina to see the cervix and the vaginal walls.
Right.
And finally, a bimanual exam. The provider puts 2 fingers inside the vagina while the other hand presses on the lower abdomen. This helps them feel the size, shape, and position of the uterus and ovaries.
Seems quite thorough. And beyond the hands-on exam, there are standard screening tests, right, for prevention.
Absolutely. Screening is vital for catching things early. The pap smear is the big one for cervical cancer screening.
How does that work?
Cells are collected from the surface of the cervix and checked under a microscope for any precancerous or cancerous changes.
And HPV testing often goes along with that.
Yes, very often. Human papillomavirus testing. Because persistent infection with certain high-risk HPV types is the main cause of cervical cancer. So testing for the virus itself is really important.
Makes sense. And for breast cancer screening?
Mammography is the primary tool there. It's a low-dose X-ray of the breast tissue.
What can it show?
It can detect masses or tiny calcium deposits, called calcifications, that might signal cancer, sometimes long before a lump can even be felt.
Okay. Now let's talk about some specific lab tests and imaging that give even more detailed info. Pregnancy tests, for instance. What are they actually detecting?
Pregnancy tests, whether blood or urine, look for HCG, human chorionic gonadotropin.
HCG?
Yeah. It's a hormone produced very early on by the developing placenta, right after fertilized egg implants. So if HCG is there, it's a strong sign of pregnancy.
Got it. And hormonal testing,
Right.
measuring levels of FSH, LH, estrogen. When is that done?
Doctors might order those hormone tests for a bunch of reasons, investigating irregular periods, fertility problems, or symptoms that suggest a hormonal imbalance, like during perimenopause or with conditions like PCOS, polycystic ovary syndrome. Prolactin might be checked too sometimes.
We mentioned the pap smear for cervical cells. What about STD testing in this context?
Screening for STDs, sexually transmitted diseases or infections like chlamydia, gonorrhea, HIV, syphilis, it's really critical, especially for anyone sexually active.
Why is it so important for reproductive health specifically?
Because if left untreated, some STIs can cause serious damage. They can lead to pelvic inflammatory disease, PID, which we'll get to.
Okay.
And that can cause chronic pain and even infertility down the line.
Right. Serious consequences. Now, imaging techniques like ultrasound and mammograms give us pictures. What do they help visualize?
Ultrasound, especially pelvic or transvaginal ultrasound, that uses sound waves. It lets clinicians see the uterus and ovaries, check their size, shape, look for things like cysts, fibroids, or maybe unusual thickening of the uterine lining.
And mammograms we covered are for breast tissue.
Right, specifically for breast cancer detection, looking for masses or calcifications.
Are there other imaging tools used?
Yeah, in certain situations, maybe for more complex cases or to get a clearer view, doctors might use MRI or CT scans, particularly if they suspect reproductive cancers.
Okay. Let's dive into some of the common disorders now, starting with ones affecting the menstrual cycle or reproductive tract. Amenorrhea, the absence of periods.
Right. Amenorrhea just means no menstruation. It's normal, of course, during pregnancy and breastfeeding.
But otherwise,
Otherwise, it can signal various things. Hormonal imbalances are a big one, problems with the ovaries or the brain's control system, but also things like high stress, certain medical conditions, big weight changes, or even really intense exercise can cause it.
so finding the underlying cause is key.
Absolutely.
What about dysmenorrhea? Painful periods, so common.
Very common. It's basically cramping pain in the lower abdomen around the time of menstruation. There are two main types.
Okay.
Primary dysmenorrhea isn't caused by another condition. It's thought to be related to prostaglandins, hormone-like substances the uterus releases. They cause muscle contractions, which cause pain.
And secondary.
Secondary dysmenorrhea means the pain is caused by an underlying issue, like endometriosis or uterine fibroids.
Got it. Then there's menorrhagia, heavy menstrual bleeding. How heavy is too heavy?
Yeah, menorrhagia is a bleeding that's abnormally heavy or goes on for too long, really interfering with life, like needing to change pads or tampons super frequently, passing large clots, bleeding for more than a week.
What causes that?
It can be hormonal imbalances, growths like fibroids or polyps, certain bleeding disorders, or sometimes, though less commonly, uterine precancer or cancer.
Okay. Endometriosis. You mentioned it can cause secondary dysmenorrhea. What exactly is it?
Endometriosis is when tissue similar to the uterine lining, the endometrium, grows outside the uterus.
Where does it grow?
It can be on the ovaries, fallopian tubes, the outer surface of the uterus, sometimes even further away, though that's rarer.
And that tissue behaves like the uterine lining.
That's the problem. It responds to the monthly hormonal cycle. It thickens, breaks down, and bleeds. But that blood has no way to leave the body.
Ah, so it causes inflammation.
Exactly. Inflammation, pain, and it can lead to scar tissue or adhesions forming between organs.
Sounds really painful.
It often is.
What about PCOS, polycystic ovary syndrome? You mentioned it earlier.
Right, PCOS. It's a pretty common hormonal disorder. It's complex, but key features often include irregular or absent periods.
Okay.
Sometimes small cysts on the ovaries, though you don't have to have cysts for a diagnosis, and elevated levels of androgens.
Androgens, like testosterone.
Yeah, hormones often called male hormones, though everyone has them. Higher levels in PCOS can cause things like acne or extra facial and body hair.
Anything else associated with PCOS?
Yes, insulin resistance is common, which can affect weight and increase the risk for type 2 diabetes, and it can impact fertility too.
Wow, it affects quite a lot. Lastly in this group, pelvic inflammatory disease, PID. You said it's linked to STIs.
Yes, PID is an infection of the reproductive organs, uterus, fallopian tubes, ovaries, and the most common cause is an untreated STI, usually chlamydia or gonorrhea.
How does the infection spread?
The bacteria travel up from the vagina and cervix into the upper reproductive organs. This causes inflammation.
And potential long-term damage.
Yes, unfortunately. Chronic pelvic pain, scarring of the fallopian tubes, which can lead to infertility. It's serious if not treated promptly.
Okay, let's switch focus now to common issues affecting breast tissue. Fibrocystic breast changes sounds a bit scary.
It can sound concerning, but it's actually very common and benign. It means the breasts feel lumpy or kind of rope-like.
And it can be painful.
Often there's tenderness or pain, yeah. And it tends to fluctuate with the menstrual cycle because it's related to hormonal changes. But importantly, it's not linked to an increased risk of breast cancer.
That's reassuring. What about fibroadenomas, another type of lump?
Yes, fibroadenomas are also benign, but they're distinct lumps. They're solid tumors, usually smooth, firm, and quite mobile. You can move them around a bit.
Are they common?
Most often found in younger women. Again, they aren't cancerous and don't usually raise cancer risk, but sometimes they're removed just to be sure or if they cause discomfort.
Okay. Mastitis, we often hear about this with breastfeeding.
Yes, that's when it most commonly occurs. It's inflammation or infection of the breast tissue.
What causes it?
Often bacteria, maybe from the baby's mouth, getting in through a cracked nipple. Or it can be caused by milk building up if the breast isn't emptied, effectively milk stasis.
And the symptoms?
Breast pain, redness, warmth, swelling. Often feels like the flu, too, with fever and chills.
Right. And then, of course, breast cancer, the one everyone worries about.
Understandably, breast cancer is when abnormal cells in the breast grow out of control, forming malignant tumors.
It's not just one disease, is it?
No, it's complex. There are different types and subtypes. That's why early detection is so incredibly important.
Through screening like mammograms and self-examining?
Exactly. Catching it early dramatically improves treatment outcomes. Treatments vary a lot. Surgery, radiation, chemo, hormone therapy, targeted drugs, depending on the cancer specifics.
Okay, that covers a lot of the common disorders. Now let's talk treatments. Hormone replacement therapy, HRT for menopause symptoms.
Yeah.
You mentioned potential risks.
Yes, HRT uses medications with estrogen, sometimes progesterone, to replace those declining hormones. It can be very effective for symptoms like hot flashes, night sweats, vaginal dryness, and it helps bone density. But some large studies raise concerns about potential risks, like a higher risk of blood clots, stroke, maybe certain cancers, especially with particular types or long-term use.
So it's not for everyone.
Definitely not. It's a very individual decision. Needs a thorough chat with a doctor about personal health history, risks, benefits. Is it the right, safe option for that person?
Makes sense. For infections like KID and mastitis, what's the standard treatment?
Antibiotics are the main treatment. The specific drug depends on the bacteria involved.
And it's important to finish the whole course.
Absolutely critical. Even if you feel better, finish the prescription to make sure the infection is completely gone and prevent it coming back or causing complications.
Right. Sometimes surgery is needed for reproductive health issues.
Oh.
What are some common procedures?
Yeah, surgery can range quite a bit. A hysterectomy is removal of the uterus. Oophorectomy is removing one or both ovaries.
And for breast cancer?
Mastectomy is removing the whole breast. A lumpectomy removes just the tumor and a bit of surrounding tissue. There are also surgeries for fibroids, ovarian cysts, endometriosis. Lots of possibilities depending on the condition.
Hormonal medications also play a big role, you mentioned, like birth control pills.
Exactly. Oral contraceptives are used for contraception, obviously, but also to regulate periods, manage PCOS symptoms, treat endometriosis pain. Very versatile.
And for fertility?
Yes, fertility treatments often involve hormonal medications. Drugs like clomiphene, for example, are used to help stimulate ovulation if someone's having trouble conceiving.
Okay. And for treating cancers in this area?
Here.
What are the main approaches besides surgery?
The big ones are radiation therapy, using high-energy rays to kill cancer cells locally, and chemotherapy, using drugs that travel through the bloodstream to kill cancer cells anywhere in the body. The specific plan depends heavily on the cancer type, stage, and the individual.
Finally, let's not forget lifestyle. How much impact do things like diet, exercise, smoking have?
A really significant impact. A balanced diet, regular exercise, not smoking. These things contribute to hormonal balance, healthy weight, overall well-being.
Can they help prevent issues?
They can certainly help reduce the risk of some conditions, like maybe aspects of PCOS, and they can help manage symptoms of things like endometriosis. Plus, they're crucial for lowering risks of certain cancers and cardiovascular disease, which we know can be linked to hormonal health.
So it's all connected.
Very much so.
Wow. Okay, just to quickly recap the huge amount we've covered, we went through the hormone dance of the menstrual cycle.
Yep, the FSH, estrogen, LH, progesterone rhythm.
The common symptoms and longer-term effects of menopause.
Hot flashes, bone density, heart health.
How assessments are done, history, exams, screenings like PAP and mammograms.
Right, the whole workup.
The purpose of different labs and imaging, from HCG to ultrasounds.
Getting that specific information.
A whole range of common disorders, from period problems like dysmenorrhea and endometriosis to PCOS and PID.
And breast issues like fibrocystic changes and cancer.
And finally, the diverse treatments, including HRT, antibiotics, surgery, hormonal meds, cancer therapies, and lifestyle changes.
It's a lot, but it really shows how intricate the system is and how tied it is to overall health.
It really does. And hopefully having this overview helps you feel more informed about your own body, or helps you have better conversations with healthcare providers.
That's the goal. Empowerment through understanding.
This deep dive really underscores the complexity, doesn't it? And the profound importance of the female reproductive system. As you digest all this, maybe think about that incredible interplay of hormones and how reproductive health really echoes through your overall well-being. What does this all suggest to you about where research and treatment are heading? And maybe more personally, what specific area we touched on today sparks more questions for you to explore further?
Good questions to ponder.
Thanks for joining us for this deep dive.